Welcome to CRH Talk, where we feature rural health professionals and dive deep into prevention, treatment, and building lasting health.
Hi everyone, welcome to CRH Talk. It is Hand Hygiene Awareness Week, and we have a special guest here today to talk about that. But first, Heather, why don't you introduce everyone? Tell us what you do around this hospital, because you do a lot.
So my name is Heather Bates. I'm the infection preventionist for CRH, and my job entails overseeing not only the hospital, but I also see all the outlying clinics and buildings. So I oversee Cancer Treatment Center, Cathcart Building, Ortho Clinic, Hospice House, and long-term care. So,
oh my goodness.
Yeah.
That's a lot of places.
It is.
So that's why I see you running all over the place then.
Yes, exactly.
And you were over at orthopedics this morning, right?
I was, yeah.
Okay. So Heather is a busy lady, and so thank you for coming on CRH Talk with us.
No problem.
Because this topic really is important. It might seem really simple to people, but how you wash your hands and why you wash your hands is vital to really keeping a lot of people safe, to keeping you safe. So can you tell us, Heather, number one, why washing your hands? Like, what's so important about it?
Well, washing your hands stops the spread of germs, number one. And it's just a good practice to get into. And I mean, the best time is really to introduce it to your children so they know from a young age why washing your hands is so important.
And every time, like you go to the bathroom.
Oh, yes.
Before you cook food, I assume.
Yeah.
Like, can you tell us when is the most, I'm kind of curious, like when's the most prime time to pick up disease? Like, there's flu's going on right now.
Yeah.
COVID. I know you're going to talk about that, but when you're going around your day, do you know like when you're most prone to get germs going to the bathroom?
Oh, yes. The bathroom doorknob is definitely by far probably one of the dirtiest things you'll touch during the day. You would think people would wash their hands, but typically they should wash their hands, but sometimes they don't. And so then they go to the bathroom, do their business, and then leave, and then touch that doorknob. So the best thing you can do is wash your hands and
use, like, should I be using a paper towel to like open the door and then throw it in the garbage after I leave?
Yes, that's what I do.
Okay.
You wash your hands, and then you take your paper towel, turn the faucets off, and then use that same paper towel to touch the doorknob, and then throw that in the trash, and then you're good to go.
Okay. So at the hospital, we don't do this anymore, but I remember we used to go through training every year. We'd have to wash our hands in front of a nurse, and they would make us sing "Happy Birthday to me."
Yes.
Happy birthday to me. Is that still legitimate? Like, should I still do it?
Oh, yeah. And that's what I teach my kids, too.
Not as long? Okay.
Yeah.
So, I mean, is there like a protocol, like in between our fingers?
Yeah. So mainly just, scrub. Friction is good. So you're washing your hands, scrub your hands, and then, just like you were doing in between your fingers. And then another thing you can do is go like this to get under your nails.
Yeah.
And then your thumb, so get it all. And then try to get up here too, because sometimes germs get up there on your wrist that you're not aware of.
Okay.
So
and if you're not watching this and you're only listening, when she says up there, it's like, up on your wrist, forearm area.
Yeah.
Okay. All right. Yeah, because I did too, where they did the glow lights.
Yes.
And
I just got some glow lights. So
nice.
Yeah.
You can kind of still see that even though you wash your hands, you think really well, you're still missing some things. So
right.
Yeah. When's a good time then if you can't wash your hands? Like, should you use a certain type of hand sanitizer or?
Yeah. So Purell is a great one. Anything with 60% or above alcohol is excellent. And most hand sanitizers are now 70%. So that's excellent.
Okay.
So what I do is anytime I go to any store, as soon as I get in the car, I have hand sanitizer in the console, and I just put some in my hand, put some in my kids' hands, and we wash our hands before we touch anything in the car, including our phones.
Okay.
And phones are really dirty too. So if you could just remember to use like a Lysol wipe every, every time you think of it, even if it's, at the end of each day, use it because, you're in bed using your phone, and you probably have all those germs from the day on that phone. So,
yeah, I know that is one place I forget to wipe down is my phone.
Yeah.
I'm on it too a lot. So, okay. So what else about Hand Hygiene Week that we need to tell everyone that's very important?
So opportunities to wash your hands, not only before and after meals, but also before, during, and after making any kind of food. Because when you prepare food, you always want to make sure you have clean hands when you do that, especially with the holidays coming. You're going to be making meals for friends. You want to make sure that you're making clean food for everyone and not getting the germs that you were touching in that food. Before and after caring for someone who is sick. Like if you have a sick kid at home, make sure you wash your hands. Or if you have a sick parent or a grandparent that you're taking care of, make sure you wash your hands. Before and after cutting meat or raw, touching any kind of raw food, after touching any cuts or wounds, after changing diapers, make sure you clean your hands. Blowing your nose, coughing or sneezing. And then, of course, you always want to remember if you cough or sneeze, try to do it into your elbow. We call it the vampire cough or vampire sneeze. After blowing your nose, coughing, sneezing, after touching an animal food or animal waste, after touching garbage. And if you're not sure you should wash your hands, then you probably just should wash your hands.
Yeah. Well, what I just did, I kind of itched my nose, and I was told, and tell me if this is true. I asked a walk-in care clinic provider, and I asked, how do you serve so many patients? We're talking thousands a month and not get sick. And she goes, I don't touch my face.
Yes.
So I've always been told, your mouth is a hole, your nose is a hole, your ears, try to stay away from your entrance points.
Correct.
Is that right?
Yeah.
Okay.
Mm-hmm.
Okay.
And your eyes. Yeah.
And your eyes.
Yes.
Yeah.
Yeah, because you could be touching anything, that doorknob, for instance, and then touch your eyes and you could get pink eye. So, germs are everywhere.
Yeah.
Yeah.
I know, it kind of makes you, I don't want to be, what is it, OCD or, I don't want to get overly afraid or anything.
Because some germs are, good for you, exposing you. So, you don't want to be overly afraid, but you just need to be cognizant of, okay, I need to wash my hands. I just touched that, and there's probably a lot of germs on that. So,
well, we're not wearing masks as much anymore, and I think with a mask on all the time, I didn't touch my face,
right?
And so I didn't get sick very often. But now that I don't wear my mask as much, it's I find myself scratching my nose or rubbing my eyes or doing something that maybe I typically wouldn't do. So, just to be aware, right?
Right. Exactly. Yeah, the masks were easy in that regard, because it was okay, don't touch your face because you have a mask on. So,
well, I know here at our hospital, we're supposed to not, what's it called? Not don in, don off, but
don and doff. Yeah. So
we don and doff every time we go into a patient room is what we're supposed to do, right? Wash our hands or.
So hand hygiene, you gel in and gel out.
Okay.
Unless your hands are visibly soiled or you have a patient with an infectious disease that you need to use the soap and water. But yes, you should every time before you go in and out.
Is there anything else that you're responsible for, making sure that we're following?
Yeah, so we do hand hygiene audits throughout the whole facility. And so I have supervisors in each department help me with those. And so it's just a spot check and making sure everyone's aware of that. And if you see someone that's not performing hand hygiene, just remind them, hey, you forgot, I saw you walked out of that room and you didn't wash your hands, don't forget. And it's just a nice reminder because, we're all human. So it's just a nice reminder. So.
Absolutely. Yes. Yeah. Well, anything else that we need to cover for Hand Hygiene Awareness Week?
Well, I have some kind of a fun fact about hand hygiene.
Yeah.
It began, hand washing awareness began in the 1840s when a Hungarian doctor named Ignaz Semmelweis began gathering data from a maternity ward. He noticed a difference in the conditions between the wards staffed by doctors and the ones staffed by midwives. That difference was that doctors often performed autopsies in addition to other medical duties and didn't wash up after working on a cadaver. Instead, they went from patient to patient, carrying germs with them. The midwives, meanwhile, didn't perform any autopsies and thus were less likely to come into contact with what Samuelis called cadaverous particles.
Oh.
Yeah. So Samuelis recommended physicians wash their hands to prevent the spread of those particles, which we now know are germs, throughout the ward. Years later, we know washing one's hands does indeed reduce the risk of a good deal of germs and bacteria.
So it works.
Yes, it does work.
Awesome. Thank you.
Thank you.
Yeah, but I know we have a lot of other things that Heather is involved with, so we will have her back on CRH Talk. But in the meantime, everyone, please wash your hands during this wonderful holiday season, and let's keep each other healthy, at least help with that. And Heather, thank you so much for coming on CRH Talk.
No problem. Thank you for having me
here. If you would, please just share a comment, share this podcast, subscribe if you haven't already. And thank you again, everyone, and we'll see you soon.
Thank you for listening to CRH Talk. Please subscribe, rate, or share this podcast. Check us out at codyregionalhealth.org and see what services we offer locally in Northwest Wyoming.